Thank you for joining us at RAIR Foundation USA today, Dr. Jon Tallinger. Can you tell us, first of all, how long have you been practicing medicine and what type of medicine are you practicing in Sweden?
Well, I've been practicing medicine for about a little more than 10 years. I've been a specialist of general practice. I've been a general practitioner specialist, which is a specialty in Sweden, by the way. I don't know if it's in other countries, but I've been doing that for, I don't know, 4 or 5 years. Yeah, that's about it.
Okay, thank you. And have you seen a lot of coronavirus patients in your practice?
A lot, not a lot, no, not
Okay.
yet.
So what exactly is taking place in Sweden that you would like the world to know about? What's the central issue?
The central issue is what I became a whistleblower, like they say. I became Dr. Whistleblower when I suspected that that oxygen was not an option for people above 80. That isn't that we don't give intensive care treatment to people above 80, and essentially I got a video and a message from government not to include patients in palliative care and to give them morphine, and there was never in the video I got which and the instructions I got, it was never an option to give oxygen. So I got this out there, and now it's gone viral in Sweden, my message. And as a response, the region of the municipality of Gävleborg, which is a municipality above Stockholm, has come out with a document that's been leaked, or I don't know if it's secret, but anyway, I have it in my hand, the document, and it reads clearly to my suspicion. I mean, it states what I suspected was going on.
Wow. So just let me dig a little bit deeper on a couple of the details here. So let's say that you had a patient who was, say, 80 years old, and oxygen was available, like technically it was there, it was available, but the government has asked that you don't administer it. Am I getting that right?
No, it's only available in Sweden in hospitals. So we're telling the general practitioners, the doctors in the outpatient clinics, not to send them to the hospital for intensive care, and at the same time, they're not supposed to be sent in to the hospital at all, so they won't get oxygen, and at the same time, oxygen is only there. It's not administered in nursing homes.
But you are supposed to administer morphine. So the question is, if you had an 80-year-old patient that, say, was suffering from the kind of pneumonia that seems to be the typical most dangerous phase of COVID-19, what would the consequences be of giving morphine to a patient with that condition?
Yeah, she would die faster. Of course, she would fall asleep faster. I mean, really much faster with the infection too. If she's hard of breathing, and she has a anxiety from not getting oxygen in her blood, and you give morphine that dampens the signal from the brain to breathe, she will fall asleep quite fast. It won't be unpleasant, but it would be immoral.
So just to be clear, by fall asleep you mean
die? Yes.
Thank you. Because it's an important distinction. And what would you like to see the Swedish government do differently?
Well, I would like them to say to start administering oxygen at a large industrial scale, of course, that's a very good treatment for COVID-19. If I mean the space between the alveoli and the small blood vessels is like it's opened up, and there's edema between those two structures, so the oxygen can't get through. And the only way to get oxygen into your body is by, making the oxygen level higher by administering oxygen. And you can survive COVID-19 without any other treatment. So it's really simple. It's not expensive either, and we have abundance of it. You just have to get going and make it happen.
So this would be right, oxygen therapy, which I've read about.
Yeah.
What would you like to see members of RAIR Foundation do to help you get your message out?
Well, actually, I'm at a stage now that I think that we're heading towards. I mean, I feel like we need outside help. We need professionals in other countries to question the decisions being made in Sweden, because it's extremely immoral towards our elderly patients that have built up the country. And I would welcome, if there was officials outside of Sweden that raised the issue that what you're doing is not okay at the state level. That's what I would like to. That's what I would like this to lead to, actually, so we can stop this development.
So you were mentioning that there might be some updates. There's some new information. What would that be, please?
Yeah, this is so as an answer to the concerns I've raised, there actually is a document now that from, as I said, the municipality. It's not the municipality I'm in, but it's one above Stockholm. I'm below Stockholm right now, and they have come out with a document for healthcare workers, stating clearly that it's not relevant with oxygen therapy for people. And I can read it to you if you want, because I have the paper right here.
Yeah, please.
I can translate it for you. So it says that oxygen therapy is not, and this is from 17th this month, from the municipality of Gävleborg. And it says that oxygen therapy is not relevant for palliative or curative care of COVID-19 patients in nursing homes or special accommodation. Most often opiates provide better symptom relief than delivery of oxygen. So they're saying that if you're in a home, in a nursing home, oxygen therapy is not gonna happen. It's not there for you to be cured by it. And it also says that at a high biological age, and they say this in the intensive care documents they've given out, that at a high biological age, and that would be above 80 years old, especially in combination with other diseases, the patient is unlikely to benefit from oxygen therapy or intensive care. So they're saying that if you're above 80, or if you have a lot of diseases and are under the age of 80, you will not benefit from oxygen in COVID-19 infection. And also it says for some elderly with single risk factors and mild symptoms, hospital care with curative treatment, including oxygen therapy, may be relevant. So if you are 81 years old and you only have hypertension and mild symptoms, you may get sent to the hospital for oxygen.
Wow. I think that's pretty clear. I got to say, thank you very much for all that. We're going to do our best to make sure this message gets out there. And just want to thank you on behalf of all of us, I think, for the Herculean work you're doing and trying to save lives.